Always a pleasure to have with us for a little bit this morning, United States Senator Bill Cassidy. Hey, Dr. Bill, welcome back to Keel. How you doing today?
Hey, Robert, good morning. Good to be with you.
Let me start our conversation by telling you we appreciate very much your calling in a bit early. But I will also say, because you said, well, I don't want to be late. A, you have never been late. And B, if I can tell you this, if it stays between us gals, between the two United States senators from Louisiana, you are, in fact, the more prompt, if you want to kind of pat yourself on the back on that one. Dr. Bill, what is, because I don't have many medical bills, knock on ceramics, what are surprise medical bills?
Yeah, surprise medical bill. Robert, I can tell you, if you haven't had one, your listeners have. You go to the in-network hospital, an in-network surgeon and everybody else, and then you get billed for an out-of-network piece of equipment. Or maybe the pathologist is out-of-network. Or, something that you could not choose, you could have not known at all, and you get a bill sometimes for thousands of dollars more than you anticipated. Now, what happens is that either the insurance company is not paying a fair rate, or the provider is not charging a fair rate in the perspective of each other, and they're using the patient as a way to go at each other. I don't mind them going at each other. I don't want it to be through the patient. So what we do is we say, listen, if you're the patient, you've gone to in-network, boom, you get an in-network rate. And the folks that want to fight, they can fight, but they don't fight with you in the middle. So we're trying to give the patient the power, in this case, the power of knowing that if she makes the right decision as to where to seek her care, it's a good decision.
You know, Dr. Bill, I've said for years and years, one of the biggest problems, if not the major problem with the American healthcare system is because of what it has evolved into this mutant form of healthcare, is that the patient is no longer the customer. The insurance companies are. What are you doing sort of tied into this to sort of bring back, I don't want to say patient rights, but to make the patient the customer, i.e. where healthcare is responsible to the patient and not the one who pays?
I like that, man. A mutant healthcare system. I'm thinking of Godzilla.
Island of Dr. Moreau healthcare, literally.
Yeah.
So I like to say that the patient should be the reason for the care, not the excuse for the bill. And we have legislation that we've been working with Democrats, Republicans, because if you want to pass a legislation, you got to have a Democratic co-sponsor. And we now have a bill which has 20 different senators co-sponsoring. So 1/5 of the Senate is now co-sponsoring, in which we just take the patient out. If you go in-network, you get an in-network rate. And you get a set of bills from your doctors, you get a hospital bill, but you don't get dinged and danged from every little bit that is part of that bill. Now, if the hospital or doctor don't like what they're paid, they talk to the insurance company directly, but you, the patient, are out of it. We have passed this legislation. You have to. There's some companies that are only monitored by the federal government, so it has to be on a federal level.
Senator Cassidy, let me ask you about paid medical leave. You're now going to be chairing a committee dealing with that. How's that going to work? I know business has a lot of concern about it.
How is it not going to make everything more expensive?
Well, we don't charge business anything to do it. And we don't raise taxes.
But government.
But they're going to have those employees. They're going to have replacement employees, right?
So there's two ways to look at it. Right now, most folks who earn about $70,000 and more already have paid family leave of something, even if it's called by something else. So they get paid vacation, or they get paid something that they're taking time off. So what you're really speaking about is folks who typically earn about $70,000 or less. Now, those women may have a child and quit because they don't get paid to stay home, but they want to stay home. They want to be with their baby. What is the cost to the employer if the employer has to replace somebody that they've spent several years training. It's a big cost to the employer. What we're doing is saying, okay, at no cost to the employer, we're going to allow the mama or the dad, but usually the mom, to stay home. We know it's good for the baby because hopefully the mama's breastfeeding, and that's the baby's immune system. It's good for the mama to breastfeed, and so they bond. Statistically, that child is going to do better. If the dad wants to then stay on for a few weeks afterwards, you kind of take care of your daycare, and then the mama or the dad can go back to work, and all the training that the employer has invested in them is not lost. They keep that employee attached to the workplace, and by the way, the employee is less likely to go on public assistance, and so it's a benefit for the taxpayer. So we think it works all the way around, recognizing that a lot of women just quit because they want to stay home with their child and they can't otherwise make it happen.
Dr. Bill, speaking of babies, as you are aware, Louisiana, the state legislature has passed, and Governor John Bel Edwards has signed what is referred to as the Heartbeat Bill. I know you feel strongly about that. What are your thoughts as this moves forward, definitely, obviously, into the courts from here?
Yeah, so we're a pro-life state. I think this reflects the values of the people of Louisiana, and it's going to be challenged. I will also say I think this whole movement started when New York passed the law that effectively allows the baby to be coming down the birth canal and to still be aborted. And there has been kind of an equilibrium established between the pro-choice and pro-life movement. And I think it was felt like that was just altered. And the governor of Virginia is talking about a baby born alive but being put to the side and allowed to die. And there was a sense, this is crazy, that our culture is now tolerating infanticide. So, seeing now in Louisiana is a statement by the folks in the pro-life movement that if you're going to upset the apple cart, we're going to start pushing back.